Good evening, I'm Nigel Boothe, and today I'll be demonstrating examination of the shoulder, and with me is Danielle.
Hi.
And a lot of times you're called upon to examine the shoulder because of pain related to the shoulder. And we must be aware that pain in the shoulder could occur from referred pain from the neck, pain from the chest, or local pain in the shoulder. And in athletes that are doing repetitive movement of the shoulder, for example, throwing athletes or swimmers, the rotator cuff is an area of concern for pain. So there are a number of special tests that we're going to do to examine the integrity of the rotator cuff. And to start the examination of the shoulder, we'll just examine the neck to make sure that there's evidence of pain, and like I said, that could be an area for referred pain. So Danielle, I'm just going to ask you to put your chin on your chest for me, please. Good. Look all the way up. Good. Put the chin on the shoulder. Chin on the left. Put the ears on the shoulder. And on the other side. Any pain with that?
No.
Okay, so I'm just going to do a little. Any pain?
No.
Okay, and the same on this side. So just turn the chin around. Pain?
No.
Okay, so from examining the neck, we'll move on to examining the shoulder. And the examination of the shoulder begins with an inspection of the shoulder. An inspection of the shoulder is looking for any deformity of the shoulder. And usually with a dislocated shoulder, you could see loss of the deltoid fold. Any deformity of the acromioclavicular joint. We're looking for muscle wasting. And muscle wasting could be wasting of the deltoid as a result of an axillary nerve injury. Turn around. Wasting of the infraspinatus fossa, okay? Or we're looking for scars on the shoulder. Scars could indicate that there's evidence of a previous shoulder surgery. Looking for scars on the shoulder. And we'd like to see winging of the scapula, suggesting a long thoracic nerve injury. So with pressure along the wall, you look to see if there is any winging of the scapula. It's normal. You can come back to me, please, Daniel. Now, from inspection, we'd like to move on to palpation of the shoulder. And palpation of the shoulder, we normally start at the sternoclavicular joint. And you're palpating for pain, you're palpating along the clavicle, testing for the integrity of the pain along the clavicle or deformity in the clavicle. At the acromioclavicular joint for pain or deformity. And from the acromioclavicular joint, if we go interiorly, we're on the greater tuberosity where we could palpate for pain. If we bring the arm up, you'd feel the bicipital groove where you could palpate for tenderness along the biceps tendon. And from palpation, we would like to move on to do range of movement of the shoulder. Okay, and for range of movement, we would do forward elevation, looking to see how far, and that's 180 degrees. Great. We'd like to do abduction all the way up. Okay, great. We'd like to do adduction, which is down. We'd like to do external rotation at the side to see how far she goes, and that's about 70 degrees. We'd like to do internal rotation, okay? And internal rotation can also be done by asking her to reach up to see how far, and her thumb goes midway between the scapula, which would be normal. So from range of movement of the shoulder, we would like to move on to do tests that would suggest that there is an impingement of the rotator cuff in the shoulder. So we would start by doing the Nair's test. And for the Nair's test, we're going to position the patient with the elbow extended, the arms internally rotated and prone, and then we'll go forward elevation. Any pain?
No.
So usually pain, most times at the end of the range of movement, is suggesting that there is impingement in the shoulder. And for impingement, you could determine if there's an anterior pain or posterior pain. So from here, we'll do the Hawkins-Kennedy test, where we'll go forward elevate and internally rotate. And this is also a test of impingement. Okay, any pain?
No.
From the Hawkins-Kennedy test, we would like to do the Job empty can test, And the Job empty can test is going to test for the integrity of the supraspinatus. So we'll do forward elevation in the direction of the scapular line, thumbs down, pressure. You're testing for strength. Any pain?
No.
If the Job empty can is positive, we can do the full can test. That is forward elevation with the thumbs up, testing for any pain.
No.
And if the empty can is positive and the full can is negative, then it suggests a rotator cuff injury. And also, if there is a injury to the supraspinatus, a drop arm test, if you just lower your arm slowly, would also be positive. And usually with a drop arm test, if there is a supraspinatus injury, the patient is unable to lower the hand gently, and you'll see ratcheting of the hand as they lower because of the supraspinatus injury. So from here we'll move on to an O'Brien's test, and the O'Brien's test is used for testing for a slap lesion. So for the O'Brien's test, we'll ask them to forward elevate, internal rotate at 10 degrees, and then we're checking for strength and pain. Any pain?
No.
Okay. So that's a negative Job test. It indicates that there is no slap lesion. And from the O'Brien's test, we're going to move on to test the integrity of the biceps tendon, and this is done by doing two tests, the speed test and the Yergamin's test. And the speed test is done if we supinate the arm and have the person forward flexion, keep the elbow straight, and we'll go against resistance. Any pain?
No.
So if there's biceps tendonitis, there is pain with a speed test. And the Yergamin's test, we'll have them you need to palpate along the bicipital groove, and with the patient arm abducted and at the side, 90 degrees flexion of the elbow, we'll have her externally rotate against resistance, okay? Or supinate against resistance, so turn the hand over, turn over, okay? And what we're looking for, if there's any tear of the transverse ligament that keeps the biceps tendon in the groove, you'll feel the biceps tendon popping out of the groove, right? Slipping, or there may be pain. So from the Yergamin's test, we would like to move on to test the integrity of the infraspinatus muscle. And infraspinatus muscle can be tested by testing internal rotation against resistance. If you put your hand and you pull in, okay, so if it's positive, they'll be unable to internally rotate or unable to resist pressure for internal rotation. And that's the test for the infraspinatus. So the next thing that we'd like to test for is the subscapularis. And the subscapularis is tested by doing what's called a gerbil lift-off test. And if we ask her to put her hand at the back and push off against resistance, okay? So if there is a subscapularis lesion, then the patient may be unable to lift the arm off, or may be unable to resist pressure for an arm lift. And if this is positive, we can also do a second test for the subscapularis, and this is where Harvard. She puts her arm up on the shoulder, and I try to pull, and she resists me externally rotating. And usually, if there is a subscapularis lesion, she's unable to resist in this position. So from here, we're going to be testing about the integrity of the ligaments that supports the shoulder. So we could do an apprehension, which is, look at me please. What we're looking for is any evidence of an anterior instability. So abduction, externally rotate, and we're doing pressure posteriorly to see if there's any evidence of any apprehension. So for a patient with a dislocated shoulder, a history of dislocated or an instability of the shoulder, they will get the sensation that the shoulder is going to pop out and get an apprehension, which is seeing an apprehension sign on the face. From the apprehension test, we're going to move on to do the relocation test. And for the relocation test, Daniel, can you line the bed for me, please? The relocation test, we're going to put the shoulder in abduction, external rotation, and any pain? Okay. If there is pain, anterior pressure on the shoulder will relocate the shoulder, and that would tend to relieve that pain. Okay. So if there is pain that is relieved by pressure and the anterior aspect of the shoulder, then the relocation test will be positive. And with that, we end the examination of our shoulder. Thank you, Danielle.